Hello and welcome to the first video from Module 1. The goal of this video and all of these videos is not to be an exhaustive coverage of all the material that is in the readings from the chapters for the module or the portion, but just to give you an overview of major concepts and talk about some things that might be new to you or might cause some issues. So today we're going to start by just talking about what epidemiology is and some of the basics of terminology and language that you'll see throughout the course. So to begin with, here are our learning objectives. We'll define epidemiology, talk about what a population is in the context of public health and epidemiology, talk about risk as a concept and what at-risk means, and then talk specifically about managerial epidemiology, largely the focus of this class, which is essentially just the application of epidemiologic principles to healthcare management. So because I'm not sure what all of your backgrounds are, I wanted to give a quick intro to public health and talk about where epidemiology fits within it first. So public health is the science and practice of protecting and improving the health of a community. So we're really focused on populations rather than individuals when we're talking about public health efforts. We typically think about things in the context of the social ecological framework or social ecological model, which is shown to the right of this slide. So basically it's just indicating that people are situated within families and communities and broader networks, and that we should not just address individual health and issues when we're trying to improve population health, but that we should really work across these multiple categories. So this could be individually focused efforts like getting people access to healthcare, but it would also be policy or society level efforts to make sure that options for healthcare are affordable and available, and then everything kind of in between. So within public health, there are 5 traditional core disciplines, one of which is epidemiology, and the others are listed there. So public health has these core functions that were enumerated in the Institute of Medicine report from 1988. And those 3 core functions are assessment, policy development, and assurance. And as you can see from this figure, it's really a cycle of going through these 3 core functions, and then there are 10 essential services within the circle there. And typically epidemiology has worked in the kind of assessment function, so monitoring health and diagnosing and investigating issues. But as we'll talk about over the course of the semester, basically all disciplines try to work within all 3 core functions. So we want to use that data, use the information that we've collected in the assessment phase to develop policies, to inform people, and also to assure that the implementation is being effective. So evaluating how things have been implemented. And so all of these are relevant as we think about managerial epidemiology as well. You want to have information, make decisions based on that evidence, that information, and then come back and evaluate and make sure that the approach is implemented as expected and that it's having the impact that we expect. So there are 3 levels of prevention that we commonly talk about in public health. Primary prevention is preventing a disease, illness, or injury from occurring in the first place. So things like vaccines are a prime example of primary prevention. Secondary prevention is really aimed at catching disease early to limit the negative impact. So screening is the primary example of secondary prevention, and we'll be talking more about screening approaches in this module. And finally, tertiary prevention is what we might think of as standard medical care. So it's people who already have a disease or condition, are experiencing some negative impacts, but trying to limit those, limiting disability, improving function, those kinds of things that we can do at a treatment level, tertiary prevention level. Okay, so finally we get to what epidemiology is. And it comes from the Greek epi meaning on or upon, demos being related to people, and then logos is just the study of. So really the study of what is upon the people. And again, when we talk about people in epidemiology, because it's part of public health, we're talking about populations. So what's happening to the health of populations? A commonly used definition that also appears in the textbook is from Last, and it is the study of the distribution and determinants of health-related states or events, and the application of the study to control diseases or health problems in populations. And one of the main kind of underlying themes of epidemiology is that disease does not occur at random. In other words, we think that there are factors, characteristics, measurable aspects of disease and risk that we can identify and intervene on in order to limit disease in populations. So going back to that definition, it's that epidemiology is the study of the distribution and determinants of disease or negative health effects. The distribution part is really what we commonly call descriptive epidemiology, and we'll be talking about that in more detail in a future module. But the distribution is really just thinking about how disease happens across a population and looking at the three primary classes of descriptive epidemiology: person, place, and time. So who is impacted, where are they, and what do the trends look like over time? Then determinants are what we really think of as risk factors. So it's any factor or event that could change health, an individual's health or the health of a population. And when we talk about risk in epidemiology, we are really just talking about the probability of an event occurring. So at risk means there's a non-zero chance of a disease happening to someone or an event happening to someone. We don't mean at high risk necessarily. So if you have heard people talk about at-risk kids in schools, we typically mean kids who are at high risk of having some negative outcome, dropping out, something like that. But in epidemiology, when we say at risk, we really just mean a non-zero chance. So this is important because when we start to talk about calculating rates and other kinds of measures in epidemiology, we always want to make sure that our denominator is people at risk. So if, for example, we are calculating rates of uterine cancer, we would want to make sure that we only include women in that denominator because men are not at risk of uterine cancer. And ideally, we'd want to even limit it to women who have a uterus. So we'd want to know, we'd want to exclude women who had a hysterectomy, who also are not at risk for uterine cancer anymore. So determinants or risk factors could be any one of a number of things. I have some examples listed here. Could be biologic or chemical agents. It could be an environmental exposure, a behavioral characteristic, genetic features. The list goes on and on. Essentially anything that could conceivably impact health could be viewed as a potential risk factor or a determinant of health. So we, in epidemiology and in public health more broadly, again, are interested in assessing, measuring, and improving population health. So in order to do that, we need to understand what the population looks like. So that's where the descriptive epidemiology typically comes in. So thinking about what has happened, what's likely to happen, and how will that impact health and disease risk. So one of the first steps we typically need to take is defining our population. And a population is any group of people that share some sort of common traits. And you as the investigator or the person making decisions can define the population however you like. So often we define it based on geography in kind of standard epidemiologic studies. If we're just trying to understand risk factors for something like cardiovascular disease, we might do something like the Framingham study, which chose a specific community, selected a very large proportion of that community into the sample, and then followed them over time. In the context of a healthcare organization, you might define your population as all enrollees, all users of your healthcare system, some other factor that makes the most sense to you and to the questions that you want to answer. So really it does depend on the research question, but it's important to put some parameters around who you're talking about, because typically we don't have the luxury of collecting information about everybody in that population. We typically have to take a sample. And so let me just skip ahead to sampling. So we want the sample to represent that underlying population. And in order to do so, we need to define that population to begin with, and then ideally select a group of people from that population on whom we can collect information or data. And again, we want that sample to look like the broader population. And again, what What does it mean to be representative? What does it mean to look like the broader population? That might also depend on your study question, but it might be based on demographic characteristics, on health status, on specific disease prevalence. And so when you're thinking about selecting that sample, you ideally want to take a random sample that will make it most likely that the sample you select looks like the source population. And so those are typically called probability samples. You could do a stratified sample and so on. Chapter 10 actually talks about sampling strategies. The other option is to do a convenient sample, and that's just what it sounds like, taking a group of people who it's easy to contact. So it might be the next 50 patients who walk through the door in a clinic. But there are lots of issues with using convenient samples because the next 50 people who walk through the door may have more health problems than the people who don't come in, and therefore your sample would not represent your broader underlying population. Okay, so going back to a little bit more about population and thinking about who is in your population, it's important to note that populations do shift over time. So even if you have a nice definition of who is included in your population, that the individuals who make up that population could shift over time. So there are fixed populations, and that is one in which nobody enters or leaves, and they're pretty rare in epidemiology in general, in healthcare settings in general. Some examples would be people who experienced a specific event. So there are follow-up studies of people who survived the 9/11 attacks or who worked to do rescue immediately after. And so that's a fixed population. That was a single event, and we can identify people who were exposed, but there's not going to be anybody entering that population newly. And in contrast, dynamic populations are what we typically work with, and that's where people might come and go. So people might enroll and disenroll from a healthcare plan. They might come and leave, come and go from specific occupations or even geographic areas. So any kind of movement within populations contributes to them becoming dynamic. So this is just a brief overview of epidemiology, some of the major concepts and what it is that we try to do in the field. And so these, this information, this field can be really useful in the context of healthcare settings. Again, thinking about managerial epidemiology is really just applying epidemiologic concepts and principles to healthcare system management to inform decisions, make evidence-based decisions. And case study 1.1 in the textbook really does a nice job of exemplifying how EPI principles can be used by managers and multiple functions: planning, staffing, controlling, organizing, and financing. So I do encourage you to read that example, and it kind of recurs throughout the textbook. So you will see it come up again in future chapters beyond chapter 1. So in summary, epidemiology is a subdiscipline of public health, and the goal really is to improve population health. And we do that by understanding the distribution of health and disease across the population, identify those determinants or risk factors for disease, use that knowledge to control disease, control exposure to risk factors, and ultimately improve population health.